There's a question most men dealing with performance anxiety keep circling back to. Is this physical or is it in my head? And the frustrating thing is that every time you research it, you find a convincing answer either way. One source says it's almost certainly psychological for men your age. Another says you should get checked for vascular issues. And somewhere in between you end up more uncertain than before you started. Let me give you a cleaner framework. The single most useful indicator is morning erections. These happen during REM sleep, driven by the autonomic nervous system independently of any psychological state. They don't care whether you're anxious about sex. They continue if the underlying physiology is intact. If you're still getting reliable morning erections but struggling during sex specifically, your vascular function is very likely fine. The interference is happening at a nervous system level, which means anxiety is the primary driver. If morning erections have reduced significantly or stopped, there's more to assess. That doesn't automatically mean something serious is wrong, but it does mean a physical component is involved alongside the psychological one. Now here's the part most articles miss. Anxiety isn't just a feeling, it's a physiological state. When the brain anticipates sexual failure, it activates the sympathetic nervous system, which releases adrenaline, causes vasoconstriction throughout the body, and creates conditions that are physiologically incompatible with erection. Erection requires the parasympathetic system, the rest and relaxation state. The two compete directly. You can't override that with willpower. And once a failure has happened, the anticipation before the next attempt triggers the same response before anything has even started. That's the cycle. The most common presentation in younger men isn't purely psychological or purely physical. It's compound. A mild physical trigger, often pelvic floor overactivity, from a desk-based high-stress lifestyle, causes the first failure. That failure generates anxiety. The anxiety causes the next failure. Now both are present. Treating only one leaves the other intact. This is why proper assessment matters. A clinical assessment covers the pattern of your erections across different contexts: physical examination of the pelvic floor, blood testing for vascular and hormonal factors, and a full lifestyle review. From that, treatment is built around what's actually driving your symptoms, not a generic protocol. If you'd like that picture specifically for your situation, rather than the general version, a free informal chat is the right starting point. No commitment involved. The link is below.